Good afternoon, everyone. I'm Dr. Santosh, consultant endocrinologist at Bangalore Baptist Hospital. Today, I'm going to speak about the different types of diabetes mellitus. So, as we all know, diabetes mellitus is a condition which is associated with high blood glucose levels, which, if not treated appropriately, can lead to complications in the future. So, basically, we can classify diabetes into four major groups. So, first is type 1 diabetes. So, type 1 diabetes is commonly seen in children and young adults. Of course, it can be seen even in elderly people also. So type 1 diabetes is caused due to deficiency of insulin secretion, that is insulin production is not adequate in the body, as a result of which the blood glucose level starts increasing. Since there is no insulin production in the body, type 1 diabetes can be treated only with the insulin injections at the present time. And then we have type 2 diabetes mellitus, which is most common type of diabetes that we come across. So type 2 diabetes is commonly seen in elderly group of people or adults, but because of the bad lifestyle, we are seeing an increasing occurrence of type 2 diabetes even in children and young people. So the cause for type 2 diabetes is multifactorial, but basically it's caused due to unhealthy lifestyle, bad dietary pattern, sedentary lifestyle, and stress. So basically what happens in type 2 diabetes is there is insulin resistance. That is, insulin production is adequate in the body, but the insulin that is produced is not functioning appropriately, or it's not acting appropriately, as a result of which the blood glucose level starts increasing. So type 2 diabetes can be managed by following a healthy lifestyle, and if this is not sufficient, then we need to treat them with oral medications or insulin for some people of type 2 diabetes. And there are newer injections available which can be used to treat this type 2 diabetic patients. So then we have type 3 diabetes, which is caused due to different conditions. For example, some genetic defects or genetic syndromes can lead to diabetes, or there are certain pancreatic diseases which can lead to diabetes. And there are certain endocrine causes or hormonal problems like thyroid hormone problems or growth hormone abnormalities or steroid hormone problems which can lead to diabetes. And there are certain drugs or medications which, if not taken under appropriate supervision, can also lead to diabetes. So all these group of conditions which lead to diabetes come under one category, and it's very important to differentiate and recognize these different types of diabetes so that appropriate treatment can be given. Then finally, we have gestational diabetes or diabetes during pregnancy. As the name suggests, this is a type of diabetes that is seen during pregnancy. So again, gestational diabetes is caused due to problems in insulin secretion and insulin action. It's very important to recognize and diagnose gestational diabetes as early as possible and treat it appropriately so as to prevent complications in both mother and the child. And gestational diabetes can be managed most of the times by following a healthy lifestyle, that is, by following a healthy diet and doing regular exercises. For some people, we may have to start medicines in the form of insulin and certain medications. So this is briefly about the different types of diabetes that we have. Apart from this, there are several other very rare types of diabetes, and it's very important to differentiate and recognize the different types of diabetes so that appropriate treatment can be given for this group of patients. Thank you.